Luis Bohigas, che
In Udine, there is also Lluis Bohigas, who's an economist, and as such, well, we asked him to tell us whether his 30 years of experience on quality can turn our healthcare system into sustainable systems, because we need to use the resources that are given to us. Thank you, Lluis.
Andrea and to Franco and to all the people that have cooperated in the organization of this event and that have invited me to be here. And thank you to you for staying so long this morning, listening to this old people talking about dreams. So yes, I am an economist. So what is doing an economist here? Well, my profession, of course, is very different from the profession of my predecessors in this table. They were mainly doctors and nurses, while I am an economist with a doctoral degree, so I am a doctor in economics. But more than that, I am a health economist. I have devoted all my career to work in the healthcare sector. I started 40 years ago in a hospital, working in hospital management. I like very much the healthcare sector, and I have stayed continuously all this time working in health institutions. At the beginning of my career, I was interested in health economics and hospital management. And I worked strongly in Spain to push for these specialties. I created the Spanish Association of Health Economics, and I was its first president. And there we received the first criticisms. The criticism among healthcare professionals because we were too focused on costs and prices and too little in quality. I took seriously this criticism and I began to study quality assurance. I came to know about quality in the US when I was doing my public health degree there. And there I read the books and articles of Abedis Donavidian. And I became fascinated by his approach to quality. Later, I met Rosa Sunyol, that has spoken earlier, and we worked together in building the Abedis Donavidian Foundation. More recently, at the beginning of this century, I worked as a general director in the central government in Madrid, and I succeeded to create there an Institute of Quality that I was its first general director. So this is to try to explain what I am doing here. Now, my second thought would be about the relationship between quality and resources. For the most part of my 40 years in the healthcare sector, budgets and resources have grown. They have never stopped to increase. It always happens that this year's budget was higher than last year's budget. And this was not a problem, even if the politicians tried to stop it, because they just freeze the budget to the previous year one, but finally they discovered by the end of the year that we have overspent and that finally the costs were always higher. Why so? Because the medicine was more powerful. We needed more specialists. We needed better paid specialists. We had much better and powerful pharmaceuticals to cure diseases. Doctors and nurses could go to other countries, so we had to pay more to retain them in our countries. So there was a logic in this growth of resources, and everybody demanded, not just the professionals and the institutions wanted more resources, but also the populations wanted to have and receive more and better health services. And we took this as a given. With this basis, we created a formula. If you wish more quality, we need more resources. We believed that this was the truth. Our experience in Spain in the last 5 years has shown us that this was not exactly it. And we are now rethinking if this formula is still a truth or just it was a dream of the past. The Spanish economic crisis. The Spanish economy was severely affected by the crisis of 2007. We had a bubble of building prices that had driven the economy up in the previous years, and suddenly in 2007 this exploded. Since then, the economy has stagnated or even decreased. The EU intervened in our economy and set goals to decrease the public expenditure. The central government in Madrid passed these reductions to the regions, and they are the responsible of healthcare services. So what the regions did was just to cut the budgets in the services. The reductions have been applied mainly in pharmaceuticals by increasing co-payment, reduction of prices, and reduction of public coverage. The number of staff has been reduced, and salaries have been also reduced. Prices for goods or services were negotiated and reduced again. The reactions of the healthcare personnel has been very strong at the beginning. We have suffered strikes and stops. Also, the population has reacted angrily. But this did not last long. My impression is that both professionals and population thought or understood that the cuts could be still worse. 4 years later, because our cuts started in 2010, the cuts in the budget, 4 years later now, the healthcare budget is 15% smaller than what it was at the beginning of the crisis, 15% less. What has happened with quality? Well, for the whole of Spain, we have data about patient waiting lists. And we have seen that patient waiting lists have become longer, and people or patients are waiting longer than they used to wait. We know for a few surveys that the population has decreased satisfaction into the healthcare services, but not very much. Not as much as we could expect for the reductions, for the budget cuts that have happened. But at the same time, we have some more transparency in the healthcare sector. Concretely, a region, my region in Catalonia, the health department has decided to open and publish healthcare data about the health services, about the performance of the health services. This data is in the public space, and anybody can analyze and study as they wish. And there has been several comparative studies being published. In summary, if we cross around all the studies, this data shows the opposite of what we expected. There has not been really a decrease in quality indicators. Some are stagnated, this is true, but even some have improved. Is this a break of our law of that we need more resources for quality? Is this just an anecdote, something that has happened now and will never again happen? It may be, this is a hypothesis, that the healthcare professionals have reacted working harder while earning less money. Or patients have gone less to the health services, and both things have happened. We don't know exactly what is the picture. This is a totally new field for us. We were not used to this in the past 40 years. the question remains, could we still increase quality by decreasing again the budgets? Or we have just find our floor and things will be worse if we go down this road? We don't know. Really, the data begin to be known and analyzed, and but what we know now is that what we thought in the past that was a law, it is not any longer. And from this observation, my thinking now is that the relationship between quality and sustainability is not an opposite one. And that's it. Thank you.